Good afternoon. I have to adjust this slightly. So I hope you can understand my Scottish accent. I'll try and talk slowly. Will this take me on to... Oh, there we go. So we're going to talk to you about AI that connects to care. So we've talked quite a lot this morning about some of the challenges facing us. I'm not going to spend too long on that in primary care. We've got multi-morbidity and ageing population, got GP burnout, funding shortages. It could go on. It's a tough environment. This is the classic kind of demand and supply curve where we talked about some of the fascinating statistics this morning showed how much that's demand outstripping supply. We've got a media that sometimes isn't a bit anti-GP, I would say. I'm obviously a bit biased. But you know, there is difficulties. Hands up if you or a member of your family struggled to get a GP appointment in the last year. Yeah, there we go. So we're struggling. And the other question I just was interested in, hands up if you work in primary care. Okay. And secondary care? Community? Great. That helps me. Okay. So these are the challenges, but it must be a better way. And we've talked about some of those better ways already. A situation where a utopia, you've got your happy clinicians, happy patients in the room together, interacting without all of the difficulties that we've already talked about. Maybe more chance to do things like this. This is a painting from a chap called Luke Fildes in 1891 called The Doctor. And I use it with my trainees. I'm a GP trainer. And this is about being in the room with a patient. And you know, obviously, difficult scene, probably at home, a very ill child in the late 19th century. But that you can tell that guy that his focus is that patient. So how can we create a modern NHS where our focus is in the room with a patient? That's what we want to do. So my name is Kevin Anderson, and I'm a GP up in Haxby, in North Yorkshire, with a practice called Haxby. And this is Dr. Bala, Sridhar, who's on the advisory board for Health Orbit. We're going to talk to you about a vision for a patient-centred, AI-enabled GP practice, and talk you through how we're going to try and go about that. So, as I mentioned, I'm from quite a large practice called Haxby, which is across York, Hull and Scarborough up in North Yorkshire. We have about 100,000 patients, so we're quite a large outfit. This is, that's York, in case you didn't know. Lovely place, came down this morning on the train. And this is us, this big practice, about 300 staff. We have an away day. This is us on our away day recently. And we'd like to think, you know, we're doing general practice reasonably well in as modern a way as you can, but we don't always get it right. We work in a pressurized system. We're very involved in training, and we're trying to sort of develop our workforce, but it is difficult, and we often feel like we're not quite getting it right. Like a lot of practices, we've brought in new systems in recent years with triage, total triage, where we're reviewing every request for an appointment. You know, most of our patients are happy, but some aren't, and some struggle to get access. And it's really important what you mentioned about the equity of access and how we make sure that all of our patients, no matter what the demographic or their age, anything, they get the access that they need. So to crystallise that, I'm going to introduce you to a lady called Margaret. And one of the things is how we get care for Margaret and let Margaret access care in a way that allows us to keep doing the day job, but think about how we could perhaps do that better. And that's where our partnership at Haxby started with Health Orbit AI, finding ways to do what we're doing a bit better. So Margaret struggles with online access, and the patient, we have online forms that people can fill in, but that's not right for everybody. So Margaret's left in a situation that Keir Starmer calls the 8 a.m. scramble, I think, but we called it the 8 a.m. battle or the 8 a.m. rush, but you know what I mean. And so she starts phoning at 8 a.m. for an appointment. She's a fairly fit 72-year-old. She's got hypertension, rheumatoid arthritis, history of anxiety, but manages well, but just can't quite get her head around some of the technology to do an online form. So she calls up. 45 minutes later, she's still trying to get through. She finally speaks to somebody. She tries to explain what she wants to say. And she then worries, have they actually understood what I meant? And then she gets off the phone, not quite sure what's happening next. They've taken the details. Is someone going to call her back? Is she to go down to the surgery? It's quite stressful, and that's when you're already ill and calling a doctor. So how can we do that better? So moving on. Might be getting low batteries. Try it again. There we go. Then the front door crisis. That's another term that we've got coined when we're thinking about this. A large practice like us probably gets around 6,000 calls a day. There's been huge leaps forward in the integration, some of the infrastructure for cloud-based sort of telephony and things over the last couple of years, which is great. And so 92% of practices now have cloud adoption. 72% of patients say that they get easy access. That's a statistic I'm not sure everyone would agree with. But we're not getting it right, despite the technology moving on, we're still not getting it right for people like Margaret, and they're still having a really difficult experience getting through. So how can we do that better? So one of the things that working with Health Orbit is how we develop AI at the very front door, but not just at the front door, in an integrated way so that Margaret's journey involves AI in a seamless way, in a way that doesn't make the doctors or the clinicians' day harder, actually helps access to the doctor for Margaret in a way that Margaret wouldn't even need to be aware that it was happening, but actually it still makes things easier. So we're talking about AI actually answering the call, potentially. We've also, Health Orbit, been working on a live language translation. Where I work in Hull, inner city Hull, we have a 20% interpreter rate, so 20% of our consultations happen with an interpreter either on the phone or in person. Generates a lot of inefficiency in terms of time. You're not always 100% sure how reliable some of the conversation is, whereas what we're hoping to end up with is a product where you have something that's listening to the conversation, brings all the summary of what Margaret said in terms of explaining the situation she's in, but all that could have happened in a different language, but then it's presented to the doctor without the use of another interpreter. And the triage, we could spend a lot of time talking about triage. I'm conscious I'll overrun, so I talk a lot, but at the moment that's done fully by a doctor, and we anticipate that carrying on, but for some of the more straightforward situations, we'll be using the AI as well as to summarise Margaret's symptoms to then potentially direct Margaret in a way that is instantly accessible to her and also brings her to the right point of care, because it's all about the right care at the right time in the right place. So if Margaret ends up in an appointment, that's booked for her. She gets all of that. That happens in an integrated way and without that 45 minutes of stressful sit on the phone. So hopefully that's got Margaret to the point of getting a consultation with the doctor. And again, this is where AI is already playing a large part in the fact that before about 40% of time, as someone else has mentioned, is spent on the administrative stuff when the patient leaves, typing it all up. So with an AI scribe, and there's various versions of that, but what Health Orbit are looking at doing is having a version of that that's integrated, does also potentially include that live language interpretation. And, press the button, sorry. The idea of that is to get that patient in the room, get the clinician in the room with the patient. So I have to say I'm a bit embarrassed, I'm a bit of a fraud here. I'm not massively understanding of all the tech, but I'm more about the vision of where we could be going with this. But one of the other big aspects of this is then the other aspects of you have one system that can integrate the management of data, not just in terms of the individual patient, but all of the records that are coming in for that person for the whole practice. And there's lots of work going on around that in those areas. I'm not going to spend too long on that. But the bit that excites me probably the most is this area where because we're all used to it now, aren't we? ChatGPT, you can type something in and it'll give you a kind of narrative of what you're asking about rather than just lots of websites. Why can't we do that with our patient notes in a way that can with guardrails in an isolated way that you can ask, tell me about this, what happened to Margaret in her 20s and 30s, and then get this little paragraph summary of why she's got history of anxiety. You could spend 2 hours doom scrolling through the notes to find that information. There's got to be a better way for that. So that's the kind of thing we're looking at doing. And then once you've done that, you can then use that for teaching. You can use it for all sorts of different applications, but in a patient-centered way. And people learn best through patients. I've done a lot of work in medical schools, and that's how you learn, is hang your learning on the patients. So this is what we're aiming for, some sort of fully connected situation where Margaret's experience in all different aspects is bounded around the AI that's being developed. And everyone has a story, and having a way to access somebody's story in a way that's sufficient for the clinician, but also doesn't mean that the real important things to Margaret get lost in that. So this is now starting to think about other aspects of what Health Orbit are doing. Probably going to hand over to Bala in a second. But one of the other aspects that Health Orbit are looking at is how we take that journey forward in terms of referrals, all the different, so many systems. Why can't they integrate better? So I'll hand over to Bala now to tell a bit about that and then a bit more context.
Thank you. Good afternoon, everybody. My name is Bala Sridhar. I work for Department of Business and Trade for our organisation called Healthcare UK. We are funded by NHS England and DHSC. But I'm not in the official capacity here today. I'm here to support Health Orbit. One of our functional role is to support UK PLCs, startups, companies who are founded here, to help them get a foothold within the UK economy and then help export their expertise to the international market through the DBT vehicle. Our journey is largely focused on, we're just going to be publishing a report on the UK's AI preparedness and readiness and the market's strength within what the UK has got to offer in the international space. In that case, I think having the opportunity to review the international global space, 4 key challenges apply to all healthcare systems, irrespective of whether you are tax-funded, you're co-payment led, like the Germans or Singaporeans, or if you're insurance-led market or out-of-pocket market. The 4 challenges are: how do you keep the cost of healthcare down? How do you improve the unit cost of health, improve health outcomes? Second challenge is: how do you improve access to good quality care at the right time? And the third one is: how do you address inequalities in health? There are 2 aspects to that. One is the dimension of how do you make healthcare systems self-sustainable, and how do you have sustainable agenda, the net zero agenda, packed into your healthcare deliverables. And the 5th and the 4th most important one is: how do you address the acute shortage of skilled workforce? I think digital, as it comes across, digital health is seen as a kind of panacea to address all of the 4 challenges. This is in context with the increased number of non-communicable disease identification that's in oncology, cardiology, diabetes, and in some parts of the world, there is double burden of disease, both malnutrition, overnutrition, and we talked about obesity. Another aspect, there is communicable and non-communicable disease. So those are the givens that we are working in the international space. What the international market is looking at is: what is the NHS doing about it? How are we applying ourselves, and what lessons can they learn from us? In terms of the referral gap and how AI is going to be deployed in here is, we are a highly segmented system. We've got primary care, secondary care, tertiary, community, mental health. But the patient is one. And how is the patient navigating those sectors across the board? One of the things that AI can do is bridge that gap, bridge that crossover from, as Kevin mentioned, Margaret, having access to the primary care, could have a footprint in other care systems, other care sectors within the UK. Is the GP or is a clinician providing care at the front end got visibility of that patient's record? And we have all tried being there. I've deployed tech in healthcare for 30 plus years. Started with EPRs, finished off with the interoperability platform for various in Cheshire and Merseyside, connected care. So the idea is, the visioning is, how can we surface the data at the right time for the right people? I think I'm not going to go through these, but this is the vision that's been envisioned. I think we have heard a lot of this talk about this, bringing the whole concept to the 5 key priorities. And in terms of your own, how the government is going to do the procurement, I think the key thing is about, is cross-boundary working. Buy once, scale it up a lot. That is the biggest agenda. So it's a national driver. There's a regional platform. There's also local areas, how that can be consolidated procurement, consolidated deployment of tech is going to be taking place. I'll skip this slide. I think the biggest thing is to say 30% of health outcomes comes from healthcare. 70% comes from other social determinants of health. So how can we connect the other parts of the care pathways, the social elements of a care with the patient's journey? So how can we integrate that and create a smarter, connected technologies? AI has a big role to play, and Health Orbit's solution is it's a sector-agnostic platform. It doesn't really matter whether you are in primary, secondary, or community care. It can work in clinical and non-clinical areas. The whole idea is to bring on board your problem statements and can work a solution accordingly. I think we are out of time. Okay, there you go. I think, in terms of generative AI, this just to give the flavor of where the UK market is looking at. We are working against, we are a bit behind. The other international markets have already put the best foot forward in terms of things, but the depth of our offering and our ability to, showcase the world is very many. Thank you.